All right, folks, if you are watching our YouTube recording, we are about to go live in front of our studio audience. You're here with our esteemed panel. Bear with us. All right, folks. Here we go. Hello, everyone. This is Eric Glazer, and welcome to Bright Spots in Healthcare, produced by Shared Purpose Connect. We bring leaders together to inform our audience, but also unearth bright spots, successes at health plans, hospitals, and other healthcare-related organizations around the nation. We believe this approach of finding a bright spot and cloning it is the most effective strategy to improving healthcare in our lifetime, and that's why we do this show each and every week. Our sponsor for today's episode is Wisdo. Wisdo is a peer support and clinical referral platform designed to address the harmful consequences of loneliness, social isolation, and lack of engagement on health and medical costs. You can learn more about them at wisdo.com. They're a really interesting company. I'm going to tell you more about them later on in the show because today's topic is peer support to improve Medicare Advantage outcomes. This is one that is near and dear to my heart. I have spent a fair amount of time building and researching programs like this in other parts of my healthcare roles. And I could tell you that this is or can be one of the key innovative solutions around closing gaps in care, improving your CAP scores, and also driving better clinical navigation within all of your wellness services. If you're a health plan out there trying to move your star ratings up from 3 to 3.5 to 4 and 4 to 4.5, maintain that ratings, we know how hard it is getting. So I highly encourage you to get a pen and paper, get ready to take some notes. This is going to be an incredible panel with an incredible group of guests you see in front of you with a lot of interesting things to say. And I, if you can't tell, am super excited about today's episode. If you have not started subscribing to our podcast, I don't know what you're waiting for. Bright Spots in Healthcare, wherever you consume a podcast, click subscribe. Every single episode drops down to your tablet, your phone, wherever, and you get to get access to all the great episodes we've done over the last couple of years. Most of our topics are fairly evergreen. You get executives from all over the industry sharing ideas and thoughts. I highly encourage you to do it, not so much for my ego, but so you could hear all these ideas and potentially, again, channel them to your organization to make healthcare better in our lifetime. Also, I will be asking you for some feedback prior to the end of today's session. It'll come via email. Again, another email from me. And you'll get the opportunity within 2 or 3, maybe 4 minutes through multiple choice, guide us for our programming next year and give us some constructive feedback on how we can be better. So I thank you in advance for doing that. You don't want to get too many emails from us, so please take the survey. Let's start things off. I really want to get into how and why. Let's start with why health plans are investing in parent influence and support. And to start us off, let me introduce you to Dr. Mike Franz. He is the Senior Medical Director of Behavioral Health at a little-known organization called Regence. So, Mike, welcome to the show. And by the way, folks, we're not going to do bios. So if you want to learn more about this great panel and all the expertise they have, we're going to provide a link. You could click on it. We might have already sent you that link through email, but we'll put it in the chat. You could check out full bios. Dr. Franz, welcome to Bright Spots in Healthcare. Why are you guys investing in peer support programs?
Well, thanks, Eric. Great to be here. And I'll just cut to the chase. It's because the evidence is overwhelming. The evidence of what peers and traditional health workers can do for members, for patients, and for health plans is just overwhelming. There's been many studies that have demonstrated peers can reduce emergency department admissions. They can reduce inpatient admissions. They can reduce length of stays. They can keep our members, people's patients in the community longer. This is important just for quality of life. And they reduce total costs of care. So that's the bottom line, improving outcomes and reducing costs. But we also know that peers do this because they're unique. And we all know that they have lived experience and that they're the secret sauce to engagement. But just to dig a little bit deeper into why they are the secret sauce to engagement and can get these kind of outcomes and reductions in costs, I just like to point out what I've learned about some peers that I've worked with in the past. It starts with them having a sense of gratitude. They've been through a journey and they're coming out the other side and they're in recovery. And through that gratitude, they've then developed an ability to render compassion and commitment to those that they serve. They also have insight into the real stigma of behavioral health in particular, but people struggling with any chronic condition. Folks internalize this stuff. They blame themselves. They get accused of being lazy. And peers come out the other side knowing none of that's accurate and that there were obstacles in their way that they overcome, and they can share that with their fellow folks that they're working with. They've also moved from hopelessness to hope. And through that, they can empathetically convey that to our members and patients that they work with, helping them see a pathway forward to recovery. They're also uniquely able to connect with our members because they aren't clinical staff. They aren't seen as the treatment provider, and that in and of itself is innately valuable. And then finally, I'll just say that they've learned to live their lives holistically, and they are able to monitor and manage their recovery. And by demonstrating that, they're an inspiration for others that they can serve and connect with and show them the way in that path forward. I'm going to talk a little bit later. I think I'll have the opportunity about how we're specifically using them, which is going to be integrating them into our case management program. So look forward to those comments in a bit.
So in summary, it's helping folks who have a shared living experience figure out where to go and where to get help. And the other thing that was interesting, and maybe we'll talk more about that later amongst all of our group here, is the power not only of helping someone who needs the help, but the power of the helper, providing them with purpose and additional support themselves.
That's correct. I think it's that personal connection and seeing that modeled that allows the person who's still struggling towards recovery to see that path forward.
So one of the many reasons I think this is a really powerful tool and thought and approach for health plans is we all know that we need to be better and better and better at focusing in at our local communities of our patient cohort. So local as a strategy is so important. And so as plans continue to thinking about local as a strategy and championing community-based care and social care, how can peer support programs accelerate their impact? That's what I want to know next. And I'm going to bring in Jennifer Spear. She's the Associate Director of Population Health at Humana. So Jen, how is Humana thinking about peer support and local as a strategy?
Yeah, thanks, Eric. It's a great question. And so our bold goal work, which is, really where Humana took that, seemed somewhat novel at the time, not anymore, because to Mike's point, it's overwhelming that health is local. Health is so specific to the community you're in. But back in 2015, we really took that lens as a national health plan to go deep into those communities we served. Even before that, we were thinking about how do we show up in those communities. So we have a number of programs, and as we're thinking about, how do we work with community health workers within the communities that we're serving. We also have our Humana neighborhood centers. And so those have evolved over the years, but those are really brick and mortar, place-based locations where the community can go in and receive a number of, they can take diabetes management classes, they can take cooking classes, they can take Zumba, yoga, whatever, harmonica classes to help address their CHF. And so they're doing that with their peers. They're showing up because their friends that they've met through those classes are still there. And to Mike's point, it's not only helping them, but it's also helping the person who maybe was in their shoes at the point of that diagnosis and they're new to the class. And we've seen this, we talk a lot at Humana about our focus on loneliness and social isolation. But even when we think about things like food insecurity, some of our programs where we're really working with populations to address their unique food needs. And specifically, if you're thinking like cultural food needs, eating culturally appropriately for a condition, that's where we really start to see that lived and learned experience, that it's not us, the health plan, it's not the case manager who, maybe the member doesn't think has ever been in their shoes. It's that person that's been there and that knows what this journey is like, what the complexities are. And so that's where we really see that not only drives, when we think about accelerating the impact of these programs, obviously we have to get people to engage in them if we want to see those outcomes. And so by really bringing in those people that our peers to our members and all of those populations that we serve, we're seeing them engage, and that's escalating those strategies because it's building that trust that is so important to really get people to buy into and to want to participate in programs, because it's not necessarily just coming from us, but it's coming from their peers in the community. So
Yeah, Jen, I want to ask you a follow-up on this because I'm big on examples and making sure people have a good sense of like if they wanted to bring this idea or maybe they have this idea, but there's an enhancement that you guys are offering to someone on the call today or listening to the show. The neighborhood centers. So tell me a little bit more about them. Do you own those centers? Are you partnering with other organizations? So how would one, if you're in a similar role at another health plan, let's say a small Medicaid or Medicare plan, be thinking about a neighborhood center strategy within their market?
Yeah, so we actually do own those brick and mortars. We also actually, because of the pandemic, as we all did, pivoted to that virtual model, which we did not think was even an opportunity, but have also seen a lot of success in that virtual model. So at first it was a need, and now it is the preference of some of our members to engage with one another virtually. But to your point, really thinking about where we have a number of members, so that critical mass, to support them in a number of ways. Like I said, it's also, they can get questions answered about their plan. They can, if they're having questions about a different benefit, they can come in and get a face-to-face someone to help them. But then also understanding the needs of that population and that community, and offering programming from instructors in the community who understand, I feel like I've said community 27 times, but who understand the needs of that community and are that friendly face who can, really help with that journey. But I think the key is it's everyone coming to a place with, Mike said it, that lived, learned experience. And so if we realize that diabetes is a big issue within the membership population of a certain community, offering cooking classes that are tailored towards a diabetic population, diabetes management programs. We have offered various fitness classes through there. So really a lot of those peer-to-peer programs that are helping to manage a condition or a life event.
Okay, that's great. I'm big on examples. We're going to be finding a lot of examples during today's episode. I want to now bring in, Boaz, it strikes me, and we've talked now a number of times in preparation for today's episode, that I haven't vetted out how to pronounce your last name. Is it Goan?
Gown, but that's close enough. Just
a little tip for anyone that's going to start their own podcast. Learn your guests' last names before going on live and recording. That would be a good idea. So sorry, Boaz. I was like, oh my gosh, we haven't talked about it. Okay, Boaz gone. So Boaz, could you provide, I'd love to get another example of how a plan is driving sort of these key elements that eventually lead to a better STARS rating, right? Because everyone here, or at least a lot of folks here, care about Medicare Advantage outcomes. And so I'd love to be able to talk about an example or how to drive sort of Medicare Advantage success, specifically thinking about, because it's on top of everyone's mind, STAR ratings.
Yep, sure. Really happy to be here, Eric. Thank you for bringing us all together. So we were fortunate enough to start a relationship with one very well-known, very reputable leader in the Medicare Advantage space, which is Humana. And we were fortunate enough to work with Jen and her incredible team for over a year in really trying to build a well-designed peer-to-peer community that would end up moving the needle on exactly the measurements that you mentioned. And some interesting insights to share with people who are listening to this conversation. So really the approach was to say, can we bring in people who are looking for social support? Can we make sure that they get access to social support? And can we demonstrate specific measurements that would indicate to us that we're doing this in the right way? So the 3 measurements that we looked at were UCLA, which is the standard measurement for measuring loneliness. We looked at unhealthy days to see whether people's mental and physical quality of life is improving over time by providing effective social support. And lastly, we looked at cost. And I'll get to the star rating part in a second. But first to say that the results coming out of this question of whether well-designed peer support can reduce loneliness, increase quality of life, and reduce cost seems to be a big yes. So we saw 58% of the population reducing loneliness. We saw 90% people reducing in severe loneliness. We saw unhealthy days reduced by 6.5 days. There's a directionally positive reduction of $85 PMPM or 1,020 per year. Obviously, we'll need a bigger sample to make sure this is statistically significant. But what was really I think the big insight and big surprise here is that when you invite people, and I really like what Mike mentioned in the context of bias, when you invite people who are looking for social health and social support, and you invite them to indicate what are the specific gaps in care that they're experiencing right now that they would not have otherwise shared with a plan or even a friend, and you invite them to map out where they are vis-a-vis these specific obstacles to health, you're going to see 90% of people doing that. And when you refer them to specific services, and as you said, Eric, provide clinical navigation to specific point solutions that are relevant to the specific things that they're experiencing right now, you will see, 25% of people saying, yes, well, I'm experiencing depressive symptoms right now. I'm experiencing sleep issues right now. And if you have a specific asset that you would like me to look at, I'm going to take a look at that. So I think what peer-to-peer support networks are offering us are an opportunity to appeal to a very wide audience without the fear of being biased against, increasing their engagement levels, increasing their satisfaction rates, but also leveraging the high level of trust that peer-to-peer communities know how to build to more successfully navigate more of them to clinical services when they need them.
Yeah, I love all those elements. I want to dive into a little bit later on sort of how we build that and also some of the impacts. I already have questions coming in. Jen, you spawned some of this as far as impact. We're going to hold off. We're going to get to impact ROI towards the second half of the show, folks. So don't worry, we've got it on the radar. I want to bring in Lisbeth Roberts, who's the Chief Togetherness Officer at SCAN Health Plan. Lisbeth, what's an example of how SCAN is driving better CAPS and just overall customer service experience for your members using peer-to-peer or member-to-member?
Right. So back in 2016, we were really struggling with how we're going to improve our CAP scores, how we're going to improve our HOS scores, really focusing on what we call the hard nut to crack, which were the physical activity, monitoring physical activity, improving bladder health, and reducing the risk for falls. We really had years where we hadn't moved the needle. So we decided, based on some other peer programs that we had in the company, that we would give that a try. And so we actually have members that we hired, they're part-time, that we have a very tailored training for them. We train them on how to use all of our systems, even our case management system. And then we also prepare them with motivational interviewing techniques so that when they reach out to members, they're able to really kind of dig down into the root of what's going to motivate them to make that change, to talk to their doctor about urinary incontinence or something like, or a topic that's maybe a little bit more taboo. So that's one of the ways that we've been using the peers.
Let me, I want to get into pharmacy too. So before I do that, folks, I want to tell you quickly, just a quick little segue here. So I started this show way back in 2014. And when I started it, we called it the Population Health Executive Roundtable. I should do a poll if who remembers that name, just to see how long some of you have stuck with us. But when we did that initially, it was like this private virtual program where we brought together along a topic like this one, and we brought 30 folks together. We broke them into these roundtables, and within an hour, we were able to meet almost everyone through roundtable discussions all over the phone. And eventually I moved to Zoom in 2016. That's right. I was using Zoom before all of you folks to do that. I realized that I wasn't going to be able to reach and further our mission by doing it that small. And so I converted it to the show that you all are listening to or watching right now. But I am proud and super excited to tell all of you that this upcoming summer, August 22nd and 23rd in Boston, we're going to host our first executive roundtable summit live in person. Bright Spots in Healthcare is going to bring together payers and providers to hit a number of key important topics that are relevant to all of us on the call today. The first we're going to cover whole person care as the overall theme to the session, and we're going to cover health equity and social determinants. We're going to transition that to health communication and engagement, and then we're going to hit clinical and care models. And we're going to do it all through one keynote, and then we're going to break everyone into professionally facilitated roundtable sessions. And so the premise of this is going to be 60 to 70 folks in one room talking for a day and a half together about ideas, sharing those ideas with the group, and meeting everyone. Right. So it's not like health if you're just coming back from Vegas and you're all tired from health, which was a great event, by the way. But this is going to be small, intimate, and all about bright spots and coming back to your company with ideas to further your strategy moving into the following year. It's all about enabling you to do a better job at your job for your organization and the members you serve. So I'm super excited. I wanted everyone to know about it. It's going to be August 22nd and 23rd. Sherry's going to put, our producer is going to put in the chat a link to register if you want to register for this. It is going to be, because it's small and it's going to be high end, it's not necessarily going to be inexpensive. Registration is going to be about $2,500. But if you want to pre-register, so register right now, I think we have about 20 tickets for this. You could get in at $1,595. August 22nd and 23rd in Boston. Want you to know about it. And if we'll send you some information about it as well as the week's gone. But I want to take a because I'm so excited about this. We just solidified all the details about that event about 2 weeks ago. So I wanted everyone to know about that. All right. Coming back to our conversation here, Lisbeth, what about pharmacy? Like how is peer-to-peer driving better results with Part D and everything that you get looked at around medication?
Right. So over the years, since 2016, we started to see the benefits. Everything that was shared by Mike and Jennifer, shared lived experience, more empathy, all of those things are panning out. So we decided to look at other areas besides HOS and CAPS. And this year we partner with our pharmacy department. By the way, we have 65 peers that are paid employees of SCAN, so all SCAN members. And so part of that group went to work for the pharmacy department, trying to reach members that we had been contacting all year long for the medication therapy management appointments, but we really couldn't get on the phone. So we actually used the peers. They reached out, and of course, I think we had to do a little back and forth on the phones, but they finally reached the members, and we were able to get another 35% of the members who we weren't able to reach before, that was on that list for medication therapy management, appointments scheduled with our pharmacists. So obviously it was more of like they understood from the perspective of a peer why that was so important, why that appointment was so important. So they were more willing and more open to actually schedule it. So it was a great success.
Wow. Okay. Everyone should be doing that. Right?
Yeah.
I mean, right. It doesn't seem to be, that's doable.
It's a no-brainer.
It's not hard to do. I mean, I'm sure it's hard to do, but it's not, everyone's capable of pulling that off. I know I want to bring Jen back in, who's with Humana. Jen, when we were talking about the neighborhood centers, you alluded to some other programs, you alluded to virtual as well. I'd love to talk about peer support and some of the other things that you're doing beyond the neighborhood centers, and also talk maybe about some of the additional benefits you're seeing that your members are realizing beyond CAPS.
Yeah, so Lisbeth, I kind of chuckle whenever you said there's a lot of back and forth, because one of the focuses that we have seen at Humana, and one of our lessons learned of it, honestly, is really thinking about developing, building products that meet members where they are, but meet the unique needs of members. So, I mentioned the neighborhood centers. Not everyone has one of those in their community, and not everyone wants to go outside of their home. There may be, a multitude of reasons for that, but so that's where we've really tried to think uniquely about meeting all of those unique needs. And so, I know Boaz mentioned our partnership and our programming with Wisdo, which was all virtual. And so that's also not for every member, but for the members that really want to engage within that virtual community, they really wanted to engage. They invested their time. I will say, from an implementation standpoint, it was very interesting when we first started reaching out. And Lisbeth, I don't know if this is what you were referring to, but we had members calling back like, is this a scam? Like, is my health plan really trying to connect me through this virtual community and really offer this? And so I think, to be perfectly honest, in any program we've ever done, whether it's loneliness related, food, we always see that is my health plan really offering this? Because we know this is also our Medicare Advantage population is often preyed upon from, we've really tailored, like we've really coached them to believe nothing. If it sounds too good to be true, it has to be. But so from that implementation standpoint, that was one of the challenges. And so through a lot of work and, really working with our customer service teams and the team at Wisdo to make sure that everyone was aware, yes, this is an offering. That was what really, finally got a lot of those members to engage in the program, which is then where we started to see the outcomes that Boaz mentioned. But when we think about that longer term strategy, one of the really interesting things that we saw within a matter of months, and he already kind of touched on this, but people were sharing things within the Wisdo program, sharing things with their peers that maybe we weren't hearing at the health plan. And so, for instance, through some of the communities that individuals were joining, we were able to understand there might be a behavioral health need. And so we worked with our behavioral health team to send those targeted messages to make sure that members knew what kind of behavioral health talk therapy benefits they actually had access to. So this is something we would have never known about. We wouldn't have known they had this need. They wouldn't have likely known they had that benefit unless they happened to call. And I don't know how many of us want to call a customer service line to talk about how we think we may, want to explore talk therapy or behavioral health options, just our general health plan customer service line. So I think the other component of this, though, is that as we engage members and get them to really participate in programs, we're learning more about them, they're sharing more, we can also help to connect them to other resources. So we think about, one of my colleagues always uses the whack-a-mole example that, you address one need and it just surfaces another. And so I think that through programs like this, and again, knowing that these individuals have lived and learned these same experiences, as you're addressing one component of it, we can also then start to address the other needs. So in our instance, a lot of interest in addressing those health-related social needs. So, we really could start to think about how can, once the members engaged and they're sharing more, they may be more comfortable to share, I have issues affording food or affording the right kind of food. And so starting to be able to make sure, again, they know what benefits they have access to, but also what programs and community resources and all of those different types of resources that Humana might have. So the last thing I'll touch on when we think about additional benefits, obviously member experience is top of mind across the industry. And so when we think about, our main indicator for that overall member experience is NPS. And so we saw really high NPS scores, not only with Humana, but even higher with how individuals felt about using the Wisdo program as they were in relation to their relationship with Humana. And so we know, again, if they're happy with the health plan, if they're happy with Humana, they're going to stay with us longer, and then they're going to engage in those other programs where we can then really look to long-term improve their health.
I love this. I mean, everyone should be doing this. By the way, as a quick sidebar, 90% of any stuffed animal I won in an amusement park was because of my performance with whack-a-mole, just so everyone knows that. All right, folks, I'm getting pinged, a couple people direct messaging me here Yeah, that summit I mentioned earlier is for payers and providers and our sponsors, which I should have mentioned. And then sure, I know, put that poll up. If your organization wants to get involved through sponsorship, you could click yes, you could email me, put it in direct message, maybe we'll get you more information. I want to move over to other benefits now for SCAN. So I'd love to learn, Elizabeth, what other benefits has SCAN deriving from your peer programs?
Right. So we obviously saw a really good improvement in our urinary incontinence scores. So again, because the part of the peer experience is being able to normalize conversation around certain things. And then we've had the pharmacy. So we decided to loneliness being such a huge issue and aggravated by COVID, that we actually decided to use our peers to provide interventions to outreach to members that have told us that they're lonely. So a lot of the targeting that we do for all of these programs is through self-reported data. So we do a health risk assessment for all of our members, and they tell us on that HRA if they're feeling any kind of level of loneliness. And so that then triggers a referral into our Togetherness program. So we have a Togetherness initiative, which is comprised of benefits that we've built into our plans, as well as programs that we offer to all of our members. One of the programs is our Friendly Caller program. So, and that actually kind of, Jennifer, what you were saying about NPS and all of that, we're seeing really high rates. That's really influencing member satisfaction. Any of the peer programs actually get pretty high member satisfaction. So we have some outreaches that are specific to member retention efforts, member satisfaction efforts. But in the Togetherness realm, we also have benefits that we've built into our plans, include our learning communities and even a mindfulness app that's available to everyone. And the exciting part is in the learning communities, it's mostly virtual. So we do have a few in person, but because we started it during the pandemic, we decided to start with the virtual model, which I think has been very successful and getting people. So the classes that we offer, getting people together, the classes that we offer have been around physical activity. We have this one class called Buff Bones, and people participate and do some exercise together on Zoom. We've partnered with Alzheimer's Association to provide education about brain health. We have, and we also have these coffee and conversations where we're actually just gathering people with similar interests so they can just get to know each other, talk freely. There's some moderation, moderator that's taking care of the groups to make sure that they, stay on track, that they're healthy conversations. But, we're getting a lot of really positive feedback. We're seeing people, this is really more impacting people's quality of life, kind of self-reporting, and their satisfaction with SCAN. So it's been really, very rewarding. And the way that we've been targeting people to get them into these classes, I think is really important. Some Medicare Advantage plans probably want to know is that we use a lot of the information that we gather from the health risk assessment. So we do targeted. So based on the if somebody reported to us that they are struggling with physical activity and they need more, we will actually reach out to all of the members who responded that way with targeted information about the classes that we're offering that can help them. We also do automated calls to remind people or let people know about our classes, our Togetherness. One of the most important things that we've done internally here is really set up so we have a very special culture here at SCAN. I'm sure everybody else can say the same about their organizations, but we all really band together to help the member. Our mission is very important to us, keeping seniors healthy and independent. So one of the greatest ways that we've been able to identify members and get them into our classes or get them a friendly caller is through internal referrals. So we actually work with member services because, yes, people don't want to talk to member services about their mental health needs and or other types of health needs, really. But the representative that they're talking to might get an indication that maybe this person is something's going on here. They're a little bit lonely. They're talking. They don't want to get off the phone with me. They're telling me, they're using indicators that they're kind of language that indicates they might be lonely, and they know how to refer them right over to our program so that we can outreach to them and say, hey, we have this program designed to bring people together. We'd love to, include you. We have all of our case management program is involved. So as they're looking at every case that they're about to close and they know that they want to help the person maintain maintain the gains in health that they've achieved through the case management program. One of the ways is to make sure that they remain socially engaged. So if they think that that's going to be a barrier for them long term, they will connect them with our program as well, so that we can provide that social interaction that is going to encourage them to continue with the positive progress they've made in their health. So of course, the mindfulness app, I think having just life satisfaction, being more, satisfied with yourself is going to improve your overall mental well-being and also a sense of belonging. So one thing I want to say that I kind of missed at the beginning and that I'm really, really proud of is that that we have, the reason that we have our peer program isn't just for all those members that we outreach to that show up on our health risk assessments, but we have the program itself because having a peer program helps our peers, the people that we hire. So we're giving them perpetual purpose. We're connecting them. They're having great socialization with their other peers that they work with. And so we've seen a lot of benefits and just cohesion across the peer group that I think has been beneficial. I mean, they'll tell us that their health has improved. They talk about getting into how they're navigating, any issues of access to care, and they share tips with each other. So it's really from that perspective, it's a beautiful thing to see. So I'd highly encourage having peers in your program, in your companies.
Perpetual purpose. If that shows up as an episode, I'll send you a check, a royalty check. I would have to say too, no one has ever made me a judge, but as someone who has the privilege of talking to a lot of organizations, there's definitely something different and unique about the culture at SCAN and the individuals I talk to SCAN. I mean, so I just compliments to everything you're doing. I think some of the cool things that you guys are doing, not just on this show, but other episodes that I've learned, is just everyone should be looking at how to take a little bit from SCAN and bring it to their MA population. So great stuff there. I want to, there's some really good questions from the audience. So I'm going to go off script for a bit, folks. At least I'm telling that to my guests. Get ready. If you want to take a look at them, I want to talk about the ethnicity question next. Before I do that, everything you're hearing, you should be thinking about peer programs, at least piloting one, better yet, launching one. These are not expensive to execute and implement relative to all the other things you're doing. And that's why I want to tell you quickly about Wisdo. I told you a bit about them in the beginning, a peer support and clinical referral platform designed to address the harmful consequences of loneliness, social isolation, and the lack of engagement tied to health and medical costs. But they're using actually data-driven models to map members' life challenges, goals, obstacles to health, and then proactively connects them with a trained helper, a trained peer who have been in their shoes. And this allows that helper to provide emotional support, weekly coaching, and build overall social skills and referrals to clinical and SDOH solutions offered by your health plan. Or if your employer on the call, some of the benefits you offer directly. They've been around since 2018. So it's not like they just started, and they've had over 500,000 adults, 18 to 80, who've joined their platforms to date, making it one of the most large and diverse peer support platforms on the market. So if you want to meet Bo and just pick his brain for more information, when that survey comes out for feedback and you click yes on it, I won't just send Bo your contact information. I'm actually going to email you and Bo and connect you to, so you can have a meeting. You don't necessarily have to buy their services, but you can certainly pick his brain on all the things that you need to be thinking about if you want to bring this idea or business case over to your organization and how to use peer-to-peer to drive all these great benefits you're hearing everyone talk about. You can also check them out at wisdo.com. Incidentally, they just sent me this study they did that sort of covers not only ROI, which we will get to, folks, don't worry, we're going to get to ROI, but it talks about ROI and the impact of a 12-month program on an MA population with key results. It also talks about sort of the blueprint to building a peer support strategy. It's a really interesting, really quick read, about 5 pages, I believe, maybe 6, lots of pictures and big numbers. If you want to request that so you don't have to go through any gate, Sherry will put up a poll, we'll email it to you directly, and you can take a look at it and get some of the information. It's in many ways a good summary of today's episode, to be honest with you. So take a look at that. I want, Bo, before I sort of, we've talked about big picture and the business of peer support, but I'd actually like to pause and have you provide an example of a member experience, a peer experience, like, or maybe two, like how, tell us a little bit about what happens, like who's struggling, how they access the community and the benefits they realize. So why don't you just quickly tell us like the personal part of all of this?
Sure, happy to. So, the beauty of this to some extent is that, there's been a lot of conversation around social networks and social media and what that does to a person's sense of being either supported or not supported. But what has happened is that all of us has been conditioned to pick up this machine that all of us have in our house. And it does, people 6 to probably, 85 have that little device in their house, which they identify as the gateway to support. The problem is that the current solutions out there are not designed to maximize the level of social support that you end up receiving on those products. So if we could just take that and provide a well-designed peer support experience, then that would be the best of both worlds. So the user experience, and I'll talk about 2 examples. Obviously, there are many, and I think all of us on this call really share, just a deep fascination and affection to the, human experience. We all deal with people. I think usually we see the largest impact on, and I'll give 2 examples and kind of attach them to 2 members of the community. So one is, and again, I really like what Mike said at the beginning of the conversation, are people that come in a state of hopelessness, and we are able to move them towards a place of hope. So take Rock as an example. Rock is a member of the community. He joined the community. The first community that he did join was PTSD. He was looking for some emotional support around going through post-traumatic stress disorder. Engaged with people, became a helper, received our training. There's a training that I can talk later about that helps people who have a propensity to help do that in a better way. And then one day we get a letter from Rock addressed to the entire company. And he basically says, "Dear Wisdo, I just want you to know what you did and what you were able to how you were able to affect my life. And here's my story. So I was a firefighter in 9/11. And I lost friends on that horrible day. And I left my unit thinking that I will never be able to help other people. And then I found your community and found other people that knew what I was going through. I wasn't ashamed anymore. Slowly, I came back to helping other people." And then he ends that letter by saying, "Thank you for rescuing a rescuer." So that's one story that we always go back to to show how people can move from a place of hopelessness to a place of hope. The second use case would be, and I think this is really interesting about peer support. So all of us need peer support. And if someone says that he doesn't need it or never used it, never relied on it, I think they're lying. We're not islands. We all need other people. But some of us are better at supporting other people. That's just a fact of life. And I think what peer support enables you to do is identify those people in the community. And then if you can help them help and provide the right training, then you see amazing results, not only in the people that they can help, but also in that specific sub-community, if you will, as well. So one example is Mary. Mary's came in through the Humana study that we did, and she was a retired nurse, 76 years old from Texas. She came in. She has the DNA of someone who likes to help other people. Maybe that's why she became a nurse, but now she's looking for more opportunities to do that. Again, became a helper, went through the training, and just some numbers. She ended up making 187 connections through her smartphone. She ended up sending 4,000 private messages and 3,000 group messages. And 12 months after joining, she was active 24 days out of the past 30 days. So I think what we're seeing here is if we can tailor the peer-to-peer experiment, but also digitize it in a way that would maximize social health, we would be able at the same time to help those who are hopeless move towards hope and identify those who have the propensity to help and just make sure they do it in the best way possible. And then that's how kind of the marketplace of healthfulness comes together.
It's great. I'm looking at the time and somehow we're falling behind time. I'll take the blame. Bo, do you mind, and I'll ask everyone else except maybe Mike, who I'm about to ask a question to. I want to make sure we answer that ethnic specific peer focus question and maybe post it for everyone to see. I don't know if you have time to type in some thoughts on that. And then the peer program question around care management and integrating with other vendors seems like an awesome kind of extension of everything we've been talking about. But I want to get to ROI and I want to get to org structure. So I'm going to bring in Mike Franz, who is, again, Mike, we've been icing you since the beginning. Your first answer, Senior Director of Behavioral Health at Regence. I don't know if I mentioned he is a psychiatrist by training. So Mike, I'm going to ask you two questions in one. First, sort of how is Regence planning on leveraging peers and why are they investing in it? Because I think you have similar thoughts as the other plans on the call, but maybe a little bit of a different also lens to it as well. And then how are you and how should organizations be thinking about org structure as a way to make sure a peer program fits within the organization and thus gets implemented effectively and successfully?
Yeah, sure, Eric. Well, I love the comments, all my colleagues, Bo. Those were great, inspiring stories. So Regence, we're doing something a little different, and we're really just launching this. So we're early on, but we're going to focus on the under 65 population in Medicare Advantage. And we want to do that in part because we're just getting started. We want to have a smaller group of members to work with and target, but we identified these folks because they are generally higher need. They have a higher pathological burden, more social determinants of health barriers, and they just seem like a really important group to target for a variety of reasons, some of which I'll go into in more detail. But just a little bit of orientation. Most of you probably know this, but you can qualify for Medicare Advantage under the age of 65 for several reasons. There's two conditions that can automatically qualify you. Amyotrophic lateral sclerosis, or ALS, Lou Gehrig's disease, and then end-stage renal disease. But you can also qualify with certain Social Security disability eligibility diagnoses, including behavioral health conditions. So this is the group that we're really going after, in part because a lot of these folks also, even though they're under 65, are also developing or have chronic medical conditions. And it's that intersection, and this is something I'm super passionate about, it's that intersection of behavioral health comorbidity with chronic medical conditions that really offers a tremendous opportunity to impact improvements in health outcomes on both the medical condition and the behavioral health condition, which ultimately leads to great potential to decrease total cost of care and just improve someone's life. So that's the focus of our population. It does narrow it down. And we're bringing on our peer support specialists really to do a few specific tasks. One is this broader sense of peer counseling and role modeling that I think we've all talked about specifically. But because this population is a little bit younger, we also really want to look at employment readiness. Part of the recovery process is getting people back to work if they're out of work, if they're disabled. And our peers that we're hiring have that experience as well, having been out of the job market. Obviously now back in it, they're employed with us, and they can model that pathway as well. And then there's an educational role, obviously in regards to nutrition, exercise, how to manage one's mental health, how to manage one's medical conditions, and then developing what we call a WRAP. I think some of you are familiar with this, acronym for a Wellness Recovery Action Plan. So there'll literally be a plan at the health plan level for each of our members that we're able to engage with this program that will take them through what their objectives are, what their goals are, very much member-centric, member-driven and focused. They will set the goals, and our peer and the rest of our team will support them in that process. And then, of course, the role of navigation. The healthcare system is incredibly complex, as we all know. I think these days, many of us with the prevalence of behavioral health have had the opportunity, that might be a euphemism, to try to navigate the behavioral health system for ourselves or for a family member. And it's nearly an impossible task. And the peers have had to go through that themselves, and they know some of the pearls and the pitfalls of doing that. And then what we're going to do is really place these folks moving on to structure at the case management level. Now, they're not going to be a case manager, right? Those are our licensed clinicians, but they're going to be on that team. We have a behavioral health case management team where they'll sit. It's highly integrated with our medical case management team. In fact, we're working towards a full fidelity integrated case management model that will fully operate seamlessly between medical and behavioral health for any member that's experiencing a high level comorbid conditions. And they will actually be informing and educating our case management clinicians. So I think from that org perspective, yes, they'll report up through that channel, but they're going to have a role of really being a consultant to our case management team and educating them on member experience from a perspective that many of our case managers, I won't say all of them, because some of them I'm sure have lived experience as well, may not have that innately without some additional consultation. And then we're also structuring it so that we're going to pull in, all kinds of analytics to inform an attribution list, if you will, of maybe who we want to go after and attempt to engage with our peer support specialists. So this will come from medical informatics and analytics, including health claims data, direct case management referrals, facility providers, especially our high-level facility providers, as well as other ways of getting input. And then we can proactively begin to target those folks. And again, my focus, because I know the data and a lot of it comes out of Milliman, is that there's just a tremendous opportunity to decrease that 2 to 5 times increase of total cost of care if you have someone with coronary artery disease, if you have someone with diabetes who also has depression, anxiety, PTSD. That's the difference. That's the delta between those chronic medical conditions without that comorbid behavioral health condition. And if you can close that gap, you're looking at significant dollars that then you can reinvest in the healthcare system.
Is that what's driving sort of the whole business model, sort of quality of life and all that? I mean, I'm trying to think about all the reasons, because I do want to, and we'll talk ROI here now, maybe for the rest of the time we have together. Is that the drivers? Are there other business components that you've added to this plan that maybe everyone can benefit from hearing?
Sure. I mean, I do. I'm focusing maybe a bit much on the business aspects. The thing I'm most excited about, we're going to measure several things, right? Yes, we're going to measure ED visits. We're going to measure inpatient visits. We're going to measure, are we decreasing length of stay? We're going to measure total cost of care, as I mentioned.
Hey, Mike, Mike, you froze up for a second. So I think we caught it all. ED visits, inpatient visits, total cost of care. Did I miss something? Because you did freeze up for like a second or two.
Oh, sorry about that. Am I back?
Yeah, you're back.
Okay. So length of stay, I think, was the other one. But what I wanted to get to was this notion of community tenure. And it's not a term I had heard until recently, and some of you may already be familiar with it, but it's this notion that these folks that have a high level burden of disease, social determinants of health, obstacles, spend a lot of time in higher levels of care, residential, inpatient, time in the ED. Some of the highest utilizers may spend the majority of their life over a given year or two in these levels of care, unfortunately. And the notion is to get them back into the community and try to inverse that relationship so that they're back with their family or their friends or whoever their natural supports are. And that's where they're experiencing their lives. That's where they're getting their care. So we're going to measure community tenure and see that as a high value target to hit.
Bravo. Community tenure, perpetual purpose, the two big new buzzwords coming out of today's episode. So, Bo, what about, as far as ROI goes and star ratings, how are you looking at peer programs and how is how would you advise people on writing the business case?
Yeah, so part of it is, and a big part of it is reduction in utilization of services that can be avoided by preempting that with effective emotional support. But I think what's also interesting is preventing a deterioration of an existing condition. So one of the things, and I can talk about later on in terms of measurement, one of the benefits of doing ongoing measurements is being able to very quickly notice when someone is beginning to do less well. And again, I'm not sure that those indications would be shared outside of a peer-to-peer community. And once that indication is flagged, so someone's loneliness score rises from 3 to 9 out of 9, or someone's unhealthy days score rises from 15 unhealthy days in the past 30 days to 30 unhealthy days in the past 30 days, you know that something is going wrong. And then you can intervene with the right referral or the right intervention. And that can be the difference between someone going through a mild episode that can be addressed to someone who has just gone through a severe deterioration. And the interesting part is we actually called proactively people who we saw are doing significantly less well, and suddenly they were doing well, they were improving, suddenly they saw deterioration. We called them up and asked them what exactly is going on, and they were open to share that with us, so we can be effective in kind of steering them back on the right track. And I think that is also something that shouldn't be taken for granted. People's willingness to share what they're going through when they're deteriorating towards a more serious episode, or in our world, or a part of our world, increased cost. That is something that peer-to-peer offers to you as a tool. And then last, just to remind us all, these are people. They were also moved to tears, that someone took the time to give them a call because we noticed that they're doing less well. And that ended up, increasing their sense of trust in the platform.
Yeah, I think we need to do a whole episode on the ROI of peer programs. Probably we'll talk to you guys about that. But Jen, we're cutting really tight in time here. Lisbeth and Jen, any thoughts on ROI? And is there anything around like network navigation that you guys have begun tracking or looking at? I know that has to you have to capture all of that, and it's probably hard to capture that, but just in general, ROI that might have been missed as far as people on the call thinking, wow, we want to build a business case for this. We need more ammunition. I'll let Lisbeth go first.
Thank you. So we really measure our ROI on how our outreach efforts, all of them, including our peer interventions, are impacting our NPS score, star scores, and all of that. But we are building right now, we're integrating, I think to answer one of the questions that's in the chat, we are integrating our peer advocate work more closely with our complex case management, so that we can try to help people navigate through the system, through the networks, and access the care that they need. So that's what we're going to be looking at. So I don't have data on that just yet, but given what we're seeing in other areas, we hope to see some success there as well. But we have, I think it's pretty well known that we have a very high NPS score and scan. So, that's one of the ways that we achieve that, is through this kind of additional human touch that we offer.
Jen?
Yeah, in the interest of time, I think that between Lisbeth and Mike, they've hit everything that I would add. So I will turn it over to you, Eric.
Oh, terrific. Look at you. You're like a co-host. I love it. You guys have all received the feedback form at this point. So please take a look at it and let me know if you need through that form, if you want any follow-up, whether it be about the Executive Summit, certainly about the folks at Wisdo getting more information. Great job to our audience today with the questions they've asked. I wish we had more time. I think we captured all of them, at least written answers. And a special thanks to our esteemed roundtable experts today. You guys did a great job, and for all the preparation you did. Fill out that form, folks. Give us feedback on how we should be producing more programming, and have a great rest of your day. Because remember, this is